The gentleman from New York, Mr. Higgins.
Thank you, Mr. Chairman. It's obvious that we're still discussing health care, that, there are still many challenges in front of us. I believe that health insurance companies jack up premiums, and then when you go to use the health care that you've already paid too much for, there's very little underlying insurance. And that was a problem before the Affordable Care Act, because people could market junk policies that really didn't mean anything to anybody other than the temporary satisfaction that you had health care. Since the Affordable Care Act, I voted for it. Not perfect by any means, but 35 million more people have health insurance that's more affordable because of the Affordable Care Act. Prior to the Affordable Care Act, if you had a kid that was stuck with cancer, an insurance company could deny you coverage because of a pre-existing condition. You can't do that anymore. It's against the law. Policies have to cover pre-existing conditions. What are they? Diabetes, cancer, epilepsy, lupus, asthma, pregnancy, and that's just part of the list. So the insurance companies always had the upper hand. The idea here was to pool the American people so that there was leverage to negotiate a better deal for consumers that they didn't have on their own. And if the Affordable Care Act is so bad, why did our colleagues' efforts 51 times to repeal it fail? Because maybe it's not perfect, maybe we can do better, but the Affordable Care Act is better than what we had. And the whole objective was to bend the cost curve and to increase the number of people that would have health insurance coverage. Both objectives have been met. You talk about the high cost of premiums, you're right. Before, it was about 15% annually. Bending the cost curve is not taking away the annual growth in healthcare premiums, it's lowering them. Are they as low as we want them to be? Absolutely not. But if this Congress worked in a bipartisan way, like we did with an infrastructure bill which was bipartisan, we could create a better program than the Affordable Care Act. Why aren't we allowing people to buy into Medicare at 50 years old? They would save 40% on their premiums. You wouldn't have to create a new program, just allow them to enroll in the program at their own costs. So I guess my point here is that we're not defending the perfect here. Everybody, even the most vociferous proponents of the Affordable Care Act, acknowledge that it's not perfect and we still have a long way to go. But every story that you tell, the problem with rural areas, that we don't have doctors and nurses and healthcare providers, they don't want to go there. Why? Because there's not the population where they can make as much money as they otherwise would be able to do in a more densely urban or suburban area. So we all have an obligation on both sides of the aisle to do a lot better for you. The Inflation Reduction Act, again, was just a start. I've been here for a lot of years, and everybody's been talking about why aren't they authorized to negotiate drug prices? The VA does it, and they realize a significant reduction. Why? Because life and insurance is all about leverage. So why wouldn't we use the leverage of Medicare beneficiaries to lower the cost and drive up the quality of health care on behalf of all of you who have a personal story that I believe. So the Inflation Reduction Act begins to do that, but unfortunately progress in Congress is typically very incremental. We should be making major progress to hold down the cost of insulin, which this bill does. to hold down the costs of individuals on a yearly basis to $2,000. But they're never a finish, they are a start. And all of us should demand much better from Congress, particularly hearing your stories, and particularly when it comes to the high cost of health care. With that, I'll yield back.
Thank you.